Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports injuries, injury treatments, injury prevention, and sports and exercise for you. If you're an athlete, you're an active person, maybe just a weekend warrior, so that you can stay healthy and perform your best. Now, there is an injury that is sort of rare, and I'll explain what I mean by that, but I get a lot of questions about it. ACL tears, I talk about those a lot on my website and in these videos, but there is a much less common injury, a partial ACL tear, even though people think it's really common, that I get a lot of questions about on my website. And I want to answer one of those in today's Ask Dr. Geyer video. Now, as always, remember, I can't give specific medical advice online. I can't do it in any format, podcast, website, YouTube, anywhere like this. This is really meant for general information and education. So if you have a question like this, definitely submit it. I'd love to answer your question, but remember, it's in a general sense. Please talk to your doctor if you need specific medical advice. Okay, Mark asks, I have a question about my recently partially torn ACL. In January, I was playing football on a turf field, and my knee kind of collapsed inside while making a cut. At first, they said it was an MCL sprain, but after an MRI, it turned out to be a partial ACL tear and an MCL tear. It's been 2 months, and after my doctor did a bunch of tests, he said that my knee was stable. He said I should try to gain muscle back in the knee and start doing some physical activities to test it out. I was just wondering how long it would take me to get back into football if I don't require surgery and I just rehab the knee. Thanks. Okay, that's a terrific question that Mark has, and I think before I get into the specific question he asks, I think it would be helpful to discuss ACL tears and partial ACL tears. So the ACL is a big ligament in the center of the knee that prevents the tibia from shifting out from under the femur. It's really common. We do about 100 to 100 and maybe 200,000 of these surgeries every year here in the United States. And the reason when somebody has a complete tear or near complete tear of the ACL, they have an unstable knee. So when an athlete goes to land from a jump, his or her knee buckles when he or she goes to land, the knee just gives out. Or maybe she's running, plants her foot to go turn, and that knee just gives out. The knee is unstable. She can't do those activities, can't play sports because her knee gives way. Plus, every time her knee gives out, truly buckles, the tibia shifts out from under the femur, you can do more harm to the knee. You can damage the articular cartilage lining on the ends of the bones. You can tear the meniscus, those C-shaped shock-absorbing pieces of cartilage, and that can lead to even more wear and tear, more symptoms over time. So in active people, athletes, and really active people, we at least entertain the discussion of surgery to fix it. Now, partial ACL tears are a little less common. Typically, it's an all or none phenomenon. You completely tear it or you don't. Now, a lot of times you can have the vast majority of the ligament torn, but there may still be a few fibers still hanging on. What really matters is not necessarily how many of the fibers are hanging on. Maybe 10% of the ligaments left or 25% of the ligaments left. What matters is whether or not the knee is stable. Are those 10% of the fibers or 25% of the fibers actually doing what they need to do to stabilize the knee? The vast majority of the time, those fibers are also stretched out. So they may be intact, but they're not able to keep the tibia from shifting out from under the femur. And a lot of times, there's two ways to kind of figure out whether or not the knee is stable in these partial ACL tears. One is the surgeon basically does an exam. You do what's called a Lockman's test, where you test the tibia, see if it shifts out from under the femur, or a pivot shift test where you get the knee to give way in the office. Those two tests can tell you whether or not the knee is stable. So in Mark's case, he says the surgeon did a bunch of tests, felt like it was stable. He could have a very low grade, maybe a strain of the ACL, in which case the majority of the ACL fibers are intact and it's keeping the knee stable. But in these high-grade partial ACL tears where almost all the ligament fibers are torn and the rest are probably stretched out, those tests very often are positive, indicating that it's essentially an ACL deficient knee, so surgery becomes more of an option. The second way that we can determine that a lot of times is to let somebody try it out. He or she goes to run or play a sport and you test it. Basically, you run, plant your foot and turn, and you do that, with practice and with drills, and you see if the knee gives way or if it gives way with landing from a jump. some people, due to muscle strength or other factors, actually do well without an ACL or having a partial ACL, and their knee doesn't give way. But if your knee does truly buckle with those activities, again, we imply that it's an unstable knee, essentially an ACL deficient knee, even though some of the fibers may be intact, and we entertain the discussion of surgery, again, because of the risk of further damage to the knee. Okay, I hope this was helpful to you. If you've had an ACL tear or a partial ACL tear, I'd love to hear your thoughts. So below this video, leave your comments. I'd love to hear what you think about this answer, and potentially answer some other questions that you might have. Now, if you have a question, could be about ACL tear, but it could be some other bone or joint injuries in sport or exercise, definitely send those my way as well. If you like this video and want more like this about injuries, injury treatment, injury prevention, share those with me, and then obviously subscribe to my YouTube channel, or you can get it on my website as well, but you'll get those videos. I record them, say once or twice a week, and they'll be delivered directly to you. If you know anybody that's had an ACL tear, partial ACL tear, ACL surgery, share this video with them. I bet it would be helpful for them. I really want to provide as much information I can that can help, like I said, athletes and active people. Plus, I would very much appreciate it. I'd love to be able to give you resources about staying healthy and performing your best that I only share by email. So go to my website, drdavidgeyer.com, and sign up. At the top, you'll see right under an ebook that you'll get free called The Year the Healthy Athlete. You can sign up and get resources that I only share by email. I hope this video was helpful. Again, if you have questions on injuries that you might have suffered in sports or exercise, or maybe your kids have, definitely send those my way, and I'll try to answer them in an upcoming Ask Dr. Geyer video. Thank you so much, and I'll see you right here next time.